Bismillahirrahmanirrahim. Quote for today is it always seems impossible until it is done. Today I will be doing the critical appraisal of a systematic review under the supervision of my professor Dr. Saira Afzal. I will be applying Prisma Checklist 2020 on the systematic review. Title of the article is Epidemiological Situation of HIV and Monkeypox Co-infection, a systematic review. Now, according to Prisma checklist, the point that should be in the title that it identifies the report as a systematic review. So this point was followed by this article. Abstract of the article shows the most recent monkeypox outbreak is mostly affecting men who have sex with men, who participate in high-risk sexual behavior, which is typically the case among human immunodeficiency virus carriers, according to clinical and epidemiological statistics. Now, I have highlighted this line. The objective of this research is to determine the epidemiologic situation of HIV and smallpox co-infection. Until 1st October 2020, a thorough evaluation of literature was conducted utilizing the databases PubMed, Embase, Scopus, and Web of Science. Another thing that I highlighted is 53 studies met selection criteria. In addition, number of men and women whose ages range from 18 to 71 exhibited more specific sexual behavior. Co-infection with these two viruses can especially be dangerous because it can exacerbate the symptoms of both disease and make them more difficult to treat. Now, abstract according to Prisma checklist. There is a separate Prisma checklist for abstract, and I've applied it on abstract. For title, it identifies the report as a systematic review. This point was followed, as I already told. While in objective, it provides an explicit statement of the main objectives. This point was followed, objective was shown. In abstract methods, eligibility criteria, that it specifies the inclusion and exclusion criteria for the review. This point was not followed, only a thing was mentioned about selection criteria. Nothing about inclusion and exclusion was shown in the abstract. Information source. Specify the information sources. For example, database registers used to identify studies and the data when each was last searched. This point was followed. Risk of bias. Specify the methods used to assess risk of bias in the included studies. This point was not followed according to the list. Now, synthesis of results. Specify the methods that were used to present and synthesize results. This point is also not mentioned in the abstract. Now, results including studies. Give the total number of included studies and participants and summarize relevant characteristics of studies. As I told in the abstract, this point was followed. Synthesis of results. Present results for main outcomes, preferably including number of studies and participants for each. This point was followed. And last is, if meta-analysis was done, report the summary, estimate, and confidence interval. If comparing groups indicate the direction of effects, for example, which group is favored, this point was not followed. Now, discussion limitation of evidence in abstract. That it provide a brief summary of limitation of evidence included in the review. For example, risk of bias, inconsistency, imprecision. This point was not followed. Interpretation, that it should provide a general interpretation of results and important implications. This point was followed in the abstract. In others, funding. Specify primary source of funding for the review. This point is not mentioned in the abstract by this article. And registration, that it provides the registered name and registration number. This point was also not mentioned in the abstract. Now, coming towards the introduction, I have mentioned only important points of introduction here. The zoonotic disease known as monkeypox is caused by double-stranded DNA virus belonging to the gene orthopox virus. Humans can contract the virus through direct contact, respiratory droplets, fomites. WHO designated the current outbreak of disease as a public health problem of the international concern. However, HIV infection and being immunocompromised may or may not affect the presentation of monkeypox. Although it is reasonable to assume that because of the underlying immunosuppression, the course of monkeypox should be more severe in persons living with HIV. The effect of monkeypox in patients with population have yet to be determined. Given the prevalence of HIV in monkeypox cases during the current outbreak, the present study aimed to assess the epidemiology of HIV and monkeypox co-infection. Now, introduction according to PRISMA checklist. Rationale that introduction should describe the rationale for the review in the context of existing knowledge. This point was followed. Objective that it should clearly state the objective or questions of the review address. This point was not followed clearly in the introduction. This is a slide that I have taken from materials and methods in the article. This shows protocol registration, then eligibility criteria and information source in search strategy. In the eligibility criteria, I have highlighted an important line that shows we included article published up to 1st October 2020 with study designs of case reports, case series, observational studies, systematic reviews, scoping reviews, narrative reviews, randomized clinical trials, editorials, letter to editors that did not present original results, and other studies that did not answer our research questions were excluded. Now, methods according to PRISMA checklist. First is eligibility criteria. It specified the inclusion and exclusion criteria for the review and how studies were grouped for the synthesis. This point is followed in the article. Next is information source that it specifies all databases, registers, websites, organizations, reference list, and other sources searched or consulted to identify studies. And it specifies the date when each source was last searched for consulted. This point is followed in the article. Next slide is from methods that show study selection, outcome, and data collection process and data items. As you people already read the article, I will just tell about the important lines. The 3 researchers independently retrieved data into Excel spreadsheet from the chosen objects. The following details were taken out. First author, date of publication, study design, country, number of patients, age, diagnostic test for monkeypox, HIV, and other sexually transmitted infections, acute HIV anti-retroviral treatment, viral load, clinical features, location of skin lesions, treatment and outcome. To guarantee that there was no duplicate article or material, a 4th investigator reviewed the final list of included articles. Now, according to checklist search strategy, it presents the full strategies for all databases, registers and websites, including any filters and limits used. This point was followed, but filters and limits were not mentioned. In the selection process, it should specify the methods that are used to decide whether a study met the inclusion criteria of the review, including how many reviewers screened and each record and each report retrieved, whether they worked independently, and if applicable, details of automation tools used in the process. This point was followed by the article. Now, data collection procedure. Specify the methods that were used to collect data from the reports, including how many reviewers collected data from each report, whether they worked independently, any process for obtaining confirming data from the study investigator, and if applicable, details of automation tools used in the process. This point was mentioned, but the details of automated tools were not mentioned. In the data items, list and define all outcomes for which data was, this point was followed. Next point is specify whether all results that were compatible with each outcome domain in each study were sought. That is for all measures, time points, analysis, and if not, the methods used to decide which result to collect. This point was not followed. List and define all variables for which data were sought, for example, participants' intervention characteristics, and funding source. Amongst this point, funding source was not mentioned. Describe any assumption made about any missing or unclear information. This point is also not followed in the article. Study risk of bias assessment. That it should specify the methods used to assess risk of bias in the included studies. Included details of the tools used, not followed. How many reviewers assessed each study and whether they worked independently. This point was followed. And if applicable, details of automation tools used in the process. They only told about using EndNote and no other detail were given. Effect measures. Specify for each outcome the effect measures. For example, risk ratio, mean difference used in the synthesis or presentation of results. This point was not followed. Synthesis method. Describe the processes used to decide which studies were eligible for each synthesis. For example, tabulating the study intervention characteristics and comparing against the planned groups for each synthesis. This point was followed. Next is describe any method required to prepare the data for presentation or synthesis, such as handling or missing summary statistics or data conversions. This point was not followed. Next is describe any method used to tabulate or visually display results of individual studies and synthesis. They only told about EndNote using, sorry. And next is describe any method used to synthesize results and provide a rationale for the choices. If meta-analysis is performed, describe the models, methods to identify the presence and extent of statistical heterogeneity and software packages used. This point was not followed because no meta-analysis was done in the article. Describe any method used to explore possible causes of heterogeneity among the study results. For example, subgroup analysis, meta-regression. This point is also not followed. Then comes the describe any sensitivity analysis that is conducted to assess robustness of the synthesized results. This point was also not followed. Then comes reporting bias assessment. Describe any methods used to assess risk of bias due to missing results in a synthesis arising from the reporting biases. This point is not mentioned. Then certainty assessment. Describe any method that is used to assess certainty or confidence in the body of evidence for an outcome. This point was followed. This slide is taken from the results section of the article that shows Prisma flowchart. Now results according to Prisma checklist. In the study selection, describe the results of the research and selection process from the number of records identified in the search to the number of studies included in the review, ideally using a flow diagram. This point was followed. Next, cite studies that might appear to meet the inclusion criteria, but which were excluded, and explain why they were excluded. This point was not clearly mentioned in the article, so this was not followed. Now, study characteristics, that it should cite each included study and presents its characteristics. This point was followed. Risk of bias in studies, present assessment of the risk of bias for each included study. This point was not mentioned. Risk of individual studies, for all outcomes present for each study, summary statistics for each group were appropriate. This point was followed. These things were given in the results. And an effect estimate or index precision, that is confidence interval, ideally using structured tables or plots. A table was made in the results. However, there was no any information given about the confidence interval or credible interval, so this point was not followed. Results of synthesis, for each synthesis briefly summarizes the characteristics and risk of bias among contributing studies. Risk of bias is not mentioned. Next, present results of all statistical synthesis conducted if meta-analysis was done. Present for each summary estimate and its precision, for example, confidence interval, measures of statistical heterogeneity. This point was not followed. Last is present results of all investigations of possible causes of heterogeneity amongst the study results. Present results of all sensitivity analysis conducted to assess the robustness of the synthesized results. This point was followed. Reporting biases. Present assessment of the risk of bias due to missing results for each synthesis assessed. This point was not followed. Certainty of evidence. Present assessment of certainty or confidence in the body evidence for each outcome assessed. This point is not followed. Now coming towards the discussion, a theoretical idea that HIV may enhance monkeypox virus transmission and vice versa was also identified. However, there is still limited scientific information about this infection with HIV. For that reason, we summarize the case of this co-infection in order to have better epidemiological review. In this slide, I have taken limitations and limitations. Amongst the limitation of this systematic review is that the most of the studies corresponding to the case reports and case series, while longitudinal observation studies are scarce. As you people already have read article, I will not go through the all slides of discussion. I will just critically appraise them. So discussion according to Prisma checklist. First, that it provides a general interpretation of the results in the context of other evidence. This point was followed. Next is discuss any limitations of the evidence included in the review. This point was followed. Discuss any limitation of the review process. This point was also followed. Last is discuss implications of the results for practice, policy, and future research. This point was not followed because no policy making or future research was given. Now registration and protocol. First is that it should provide registration information for the review, including register name and registration number, or state that the review was not registered. This point was not followed. Indicate whether the review protocol can be assessed or the state that the protocol was not prepared. This point is also not mentioned. Then describe and explain any amendments to information provided at registration or in the protocol. This point was also not mentioned. Last is describe source of financial or non-financial support for the review and the role of funders or sponsors in the review. Competing interest, declare any competing interest of the review authors. This point was followed. However, source of financial support for the review was not mentioned clearly. Availability of data, code, and other materials. Report which of the following are publicly available and where they can be found. Template data collection forms, data extracted from included studies that are used for all analysis, analytic code, and other materials used in the review. It was mentioned that data is included in the manuscript. And that was the last slide, and thank you.